Welcome to Health Bulletin. The United States is facing one of its most intense flu seasons in 15 years. With 24 million infections, 310,000 hospitalizations, and 13,000 deaths, this winter has become a nightmare for healthcare systems across the nation. Last week, the number of people visiting doctors with flu-like symptoms surpassed even the peak of the 2009 H1N1 pandemic. This is not just a bad flu season, it's a crisis. Schools are being hit hard, with absentee rates skyrocketing. Hospitals are overwhelmed and healthcare workers are stretched to their limits. And while COVID-19 and RSV are showing signs of decline here, the flu is surging with a vengeance, along with a lot of flu cases, but also RSV and even babies with COVID-19. All of these respiratory illnesses are circulating at once, and it's putting enormous pressure on healthcare systems. 43 states are reporting high or very high flu activity, with the South, Southwest, and Western states being hit the hardest. But no region is immune. Tragically, at least 57 children have lost their lives to the flu this season. And vaccination rates for kids are alarmingly low, just 45% compared to the usual 50%. The CDC recommends that everyone 6 months and older get an annual flu shot. Yet only 44% of adults and 23% of those eligible for COVID-19 boosters are up to date on their vaccinations. Health officials are closely monitoring the flu strains circulating this season. So far, two type A strains, H1N1 and H3N2, are causing most illnesses. But there's another strain raising concerns, H5N1, a bird flu that has infected millions of animals and 67 people in the U.S. Speaking of bird flu, authorities have been forced to shut down live bird markets in New York City, even Long Island and Westchester County, after 7 incidents of avian flu were detected. All the infected flocks are being depopulated, and markets must undergo rigorous cleaning and disinfection before reopening. This is a stark reminder of how interconnected our health systems are and how quickly viruses can spread. The government has yet to release data on how effective this season's flu vaccine is, but one thing is clear: vaccination is our best defense. If you haven't gotten your flu shot, now is the time. Subscribe to Health Bulletin now for the latest updates on science and health. Be the first to know about breakthroughs, outbreaks, and life-saving innovations.